You're listening to Health Professional Radio. My name is Wayne Bucklar, and today I'm joined by Tom McLeod, who's the President of Coeliac Australia. And Tom is in Australia and joins me now from Sydney. Tom, welcome to Health Professional Radio.
Thanks, Wayne. Thank you for asking me on to Health Professional Radio.
It's a pleasure to have you with us. Now, Tom, I guess most of our audience know about celiac disease, but tell us about Coeliac Australia. What is it you do, and what geographic footprint do you service?
Yeah, look, Coeliac Australia is a not-for-profit advocacy organisation on those who are impacted by celiac disease. And by that, it is one needs to put it into context that 1 in 60 Australians have celiac disease. However, 4 out of 5 of those people are undiagnosed. So our role is to raise awareness of the disease, also to encourage those who feel that they may be celiac to seek appropriate diagnosis, and to support them post-diagnosis. Our geographic footprint is one, as our name would suggest, is all of Australia. We are the umbrella organisation that works with the state celiac societies. So there's the Coeliac Western Australia, Coeliac South Australia Northern Territory, Coeliac Victoria Tasmania, Coeliac New South Wales ACT, and Coeliac Queensland. And we have strong relationships. Each of those individual states and territories have their own operations. And we also have a very close relationship with Coeliac New Zealand and many of the global celiac organisations.
Oh, I see. Now, is most of your member service then delivered through your state organisations, Tom?
Yeah, look, it is, and we split it up because it needs to be local. The person needs to have that support close to them. They need to understand and be able to do things as basic, in inverted commas, as doing shopping tours when they're first diagnosed, to be able to have the confidence to go into a supermarket and be able to identify what food is part of a strict gluten-free diet. It is also then at a state level in terms of the organisation of the gluten-free expos. So they are held throughout the year, and in each state they're enormously popular. And then at a national level, what we seek to do is bring the common themes together, the common advocacy, common sponsorships, and also to fund research at a significant level as well.
Oh, I see. Now, Tom, as you probably know, Health Professional Radio deals with health professionals, and about 95% of our audience are some form of health professionals, lots of doctors, nurses and allied health professionals in acute care, and about the same number in aged care. What's the message you would like them to get today as a result of having heard you having a chat with us?
There's 3 things that I would like the audience to understand. Firstly, celiac disease is not a choice. When one is diagnosed with celiac disease, they have to follow a lifelong strict gluten-free diet. We benefit from the gluten-free fad, but in terms of the expansion of the available products in the marketplace, but we are not going to jump onto the next fad as soon as that gluten-free fad moves on. So that's the first thing, that it's a choice. The second thing is that it can make people consider very sick if they consume gluten. These sicknesses manifest themselves from no symptoms, which is somewhat paradoxical to describe it as such, through to quite extensive damages to organs and bone weakness. One of the key issues around undiagnosed celiac disease is the absence or is osteoporosis, because you're not getting the nutrients that you should otherwise be doing. And the third thing I'd be saying is that we collectively, as those passionate around health and the health of all, have to work hard to increase the diagnosis. 1 in 60 people in Australia, it's 1 in 70 men and 1 in 60 women are celiacs, but 4 out of 5 of those people do not know it. And many people just treat the symptoms, fatigue, brain fog and other things, as just that is the way that life has to be. And that's not the case. And so the only way that we can improve the life of people is they focus heavily on getting the proper diagnosis. And that's where the GPs and the nurses, the frontline staff, are enormously beneficial in helping us get the message out that if in doubt, check it out. And then once you're diagnosed, if in doubt, leave it out in terms of the food.
Well, that's good advice indeed. Tom, I noticed there is a Coeliac Awareness Week on the calendar. Can you talk about that?
Yeah, look, every year in March we have what's called the Coeliac Awareness Week, and it is a nationally coordinated effort, once again done at both a local and a national level, to seek to increase awareness around celiac awareness, celiac disease, hence its name. That we have taken a number of different angles over the years. This year it will continue to be a focus on the frontline diagnosers, the GPs, and those who are keen to better understand the issue. But Coeliac Awareness Week is just one element of our awareness campaign, a peak point in our year, but we seek to raise awareness throughout the totality of the year through conversations such as this, through discussions with key stakeholders and town hall type meetings, and through the sharing of information, and as I said before, things such as the Gluten-Free Expo, which is helps people understand and exposes them to world-leading thinkers in this space.
You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today in conversation is Tom McLeod, President of Coeliac Australia. Tom, in every interview there's always a favourite question for the presenter to ask, and this is my favourite question. In every industry there are misconceptions. What's the biggest misconception amongst your members, colleagues, clients, patients, doctors, and that drives you nuts and keeps you awake at night?
Yeah, look, it's not so much the misconception that constituency has about celiac disease, because if they've been exposed to it, they tend to seek to want to know more about it. It's the constituency that is either deliberately ignorant or is uneducated around celiac disease that sees it as a choice, sees it as an optional lifestyle rather than something that's imposed upon the person that has celiac disease. It is a misconception that frustrates, but at the same time, in any advocacy organisation, it also shows how large the mountain is in terms of education as well. So it's a bit of a glass half empty and a glass half full, because at least we know who we have to target with our education efforts. And I think that that's a really important message, is that we need to continue. The prize here of peace, the prize of peace is eternal vigilance. The prize of lack of ignorance is eternal education, and that's at the business that we're in.
I can understand how that misconception is big enough to give you some sleepless nights, and perhaps today will at least help with our constituency and the clinical side of it and provide a little bit more awareness among some of our listeners. Tom, it's been a pleasure having you with us. I do appreciate your time. For those listeners who have just joined us, my guest is Tom McLeod, President of Coeliac Australia. Tom, how's the best way for people to get in touch with you?
Well, there's probably two ways. One is through the website, so coeliac.org.au, or alternatively, if people want to write to me directly, they can send me an email at president@coeliac.org.au, and I'll make sure that it gets onto the right person who can handle the query that's been addressed.
Now, because I'm always getting into trouble for not giving listeners enough warning, that website again, listeners, www.coeliac.org.au. Tom, thank you for your time. It's been a pleasure having you with us.
Thank you, Wayne. I really appreciate the opportunity to speak to your audience.
If you've missed out my conversation with Tom McLeod, the good news is we have a transcript on our website. We also have an audio archive of this interview on both YouTube and SoundCloud, and you can access all of those resources through the Health Professional Radio website at www.hpr.fm. Thank you for listening. This is Health Professional Radio.